Anatomy Trains invites you to take your career to the next level with Anatomy Trains Structural Integration, ATSI. We're kicking off the next training this September in Maine under the guidance of Tom Myers and our expert team. Come map the pattern and shape the change in this transformational 3-part certification program. Visit anatomytrains.com for details. Precision Neuromuscular Therapy has been teaching high-quality seminars across the country for over 20 years. Founded by Doug Nelson, PNMT uses problem-solving skills and precise treatment options to get powerful results for your clients. PNMT seminars focus on honing your assessment and palpation skills to precisely target the source of your client's pain while understanding the why behind the what. Meet us in a hands-on seminar or online in the PNMT portal and let us join you on your learning journey. Learn more at pnmt.org.
The idea that something so automatic, like sitting or sleeping, can mess with our functionality is completely irritating. Okay, I just needed to get that off my chest. I mean, I think if I were in charge, I would make it at least so that the human act of sitting and sleeping guaranteed some pain-free moments in this otherwise roller coaster of this thing we call life. Like, rest is supposed to be rejuvenating, not crippling. For instance, after 55 years of practicing sleep, I still don't know what to do with my arm when I lay on my side. And sitting, we do it every day, and we don't even think about it until we start getting older. And then it gets increasingly harder somehow, like breathing in high altitudes. I'm going to dismantle the disaster of sleeping in a future episode. A topic that frustrating deserves its own time slot. But sitting, it's a beast all on its own. We invented chairs for Pete's sake. We needed the respite from the torture of the two alternatives, standing and laying down, and we deduced that sitting on the ground was not ideal. So we invented a thing to sit on, and it came back to bite us in the rear. Literally. Why does sitting hurt? I admit there are a lot of layers to this question. What are we sitting on? How long are we sitting? Calling you out, airplane seats. And as I alluded to earlier, how old are we? The real meat of this discussion, though, is not so much sitting, or chairs, or couches, or beanbags for that matter. The real damage is done when we cross our dang legs. There's a lot going on when we place one leg over the other. So take a seat, place both feet on the floor, of course, and let's dive in. If you follow anyone in the soft tissue business, you've heard them preach the benefits of not crossing your legs. But man, it's still so hard not to do, especially, I might argue, for women. I see a lot of men cross their legs, but the psychology of sitting pretty or properly or whatever is drilled into women from day one, even if you had the cool parents who didn't douse you in shame, it's still out there, floating around on all the platforms. So it becomes a learned automation, like eating with utensils. We almost can't imagine not doing it. When we do this simple act, though, we shift all sorts of stuff internally. To cross one leg over the other, at the very least, takes the two parallel structures that are used to hold you upright and swipes them one in front of the other. So if you think about the muscles that are then used to keep these two structures strong and mobile, by crossing your legs, you are changing their resting state of being. Not that this is bad, but to reiterate a soft tissue 101 rule, doing anything repeatedly over long periods of time is going to change the way they operate. And most of the time, this means not for the better. Mechanically, there are a lot of muscles and tendons and ligaments that morph when we sit. The psoas shortens, the glute max lengthens, the sacrum falls into counternutation, the pelvis tilts posteriorly, and the deep ligaments of the hips and the spine pull taut or soften to accommodate this position. Again, none of this is bad, no need to call an ambulance just yet. But let's take a look at the Piriformis and the TFL. Let's assume that we are looking at the right leg crossing over the left leg, as this is my go-to and therefore I can speak to it with experience. The right leg lifts up off the chair, crosses over the midline, and then rests on the left thigh. But the lower leg dangles there. It's like a weight at the end of the knee, pulling like an anchor, trying to find the ocean floor. This takes the slight external rotation out of the femur that was needed to get the leg up and over and drops it into a slight medial rotation. So the right femur is flexed and internally rotated in a resting position, meaning it's not engaging, meaning the fibers of these muscles are not firing. The TFL, if you'll remember, extends from the ASIS, or the bone you can palpate at the front of your hip, down and out to the IT band, and it's responsible for internal rotation, meaning this poor guy is now stuck in a shortened, softened position, like a nice French cheese. And the piriformis, its antagonist sitting on the opposite side of the hip, extends from the sacrum to the greater trochanter, that bone that you can feel on the lateral part of the top of your leg, and is geared to pull the hip back into lateral rotation, meaning this stringy guy is settling into being longer than it wants to be, ideally, and is getting weak, like the rope that's hanging onto that anchor in a salty sea. Then there are those who don't just cross their legs, they cross their legs and then wind their foot that's attached to their upper leg and tuck it behind their other leg's calf. Like that upper right leg has a vendetta against the left leg and it wants to put it in a chokehold. This is going to downward spiral, of course it will, to potential low back, IT band, and ankle issues. So we sit and we cross our legs every day for years. And that soft TFL and that weak piriformis sit in these states of being for most of their time. And then they are asked to move. Maybe this isn't new to them. Maybe they move semi-frequently, but maybe they are old, like not geriatric, but they are not young anymore. They can't just bounce back from being French cheese and wither rope like they used to. And this time, they just are pushed a little beyond their limits. They don't break necessarily, but they definitely can't do what they used to do. And their neighboring cohorts have been taking on a little extra responsibility for a little too long. Hip pain, my dear friends, unexplained, no sudden injury, deep aches sort of hip pain is there. This is the sort of hip pain, or shoulder or back or fill in the joint pain for that matter, that we as massage therapists see the most. It is omnipotent, especially for our clients who are, about 35 years and older. This sitting/piriformis/TFL relationship is not unique, but it is deep, hard to pinpoint, and very difficult to find relief. This is the kind of pain that a lot of people will spend weeks, months, or even years rolling on lacrosse balls, hammering through massage guns, twisting into pretzel stretches, and pretty much experimenting like a chemist to find relief. But when it comes to the one thing most people do all day long, what we need to do is adjust the way we sit. Before I acknowledge what this looks like, there are also some things that we can do as bodyworkers to help our clients who suffer from this very human affliction. Massage therapy often focuses on stretching and lengthening that which is tight, which is great. But when we understand more about a chronic issue, and when we see a TFL as chronically soft weakened, and a piriformis as chronically stretch weakened, digging in and stretching things out is perhaps not the best approach. Bodywork is about homeostasis, and these muscles in this scenario are whatever the opposite of homeostasis is. Try this. Heads up, this work is way easier if your client is wearing athletic shorts. With your client supine, bring the hip into a resting abducted and laterally rotated position. This might look like lifting their leg up off the table, bending their knee so that their foot rests on the table, and then allowing their knee to fall out laterally so that it's resting on a bolster. Ensure a comfortable position by playing around with the degree of flexion with their knee. You're not looking for a stretch here, so the more comfortable the muscles and structures of the hip are, the more likely you're going to make progress. From here, slide one hand under the hip, palpate the sacrum, and back out laterally about 2 inches towards the greater trochanter. This will place you superficial to the piriformis. Then use your other hand to navigate into the lateral hip, just inferior to the ASIS. Here, you will find the TFL. This position has slackened the piriformis because, it has rotated the greater trochanter back toward the sacrum, and it has unraveled the TFL. This one might be a little harder to imagine, but basically, by letting the IT band fall toward the table, the insertion of the TFL has relaxed, which creates a loosening of the muscle fibers themselves. Once you're here, add compression into both muscles, not as a digging mechanism, but as a resetting reminder. This is key, actually. Just like there are lists of modalities a massage therapist can practice, there are handfuls of variations of touch that are harder to distinguish. Compression can be about depth into tension, connection between fascia and muscle tissue, inhibition of a pain response, and for this instance, it can be about reawakening a neural pathway that has been eclipsed by years of cloudy positioning. Compressing into these two muscles and encouraging your client to think about those 2 points connecting, not around the side of the hip, but through the center of what is off-center, can be a moment of clarity for this person. Not because the planets will align and the heavens will open up, but because you are getting this human to see their own hip, their own structure and function differently. And that is the beginning of change. While you're here, ask your client to create some subtle engagements by lifting their knee up off the table just a little, or pressing their knee down into the table just a little, and have some conversations about what the deep hip is saying. My guess is that it's going to say a lot about feeling seen for the first time in a long time. I can't wrap this episode up without mentioning that movement is ultimately the answer. Not just movement like walking or running or skipping, but movement like anything we do for too long is not great. So if you're sitting all day, stand up more. If you're standing all day, sit more. If you're still all day, walk more. And if you're moving all day, find some stillness. You know, variety is the spice of life and all that. How do we actually incorporate all of that? I don't know. That's more for the psychologists out there. Breaking habits and patterns goes deep into the inner workings of the brain. I've suggested numerous ideas for clients, and sometimes they try them, and sometimes they just fall back into their old habits. Suggest setting a timer, or wearing a bracelet that they touch every time they sit down, or asking a loved one to yell at them every time they cross their legs. I don't know what works for each person, but I will say this. A lot of hip pain would be a lot less severe if we crossed our legs a lot less.
Do you need help with marketing, new clients, or online reviews? Massage Book is your solution, streamlining all the challenging aspects of your massage therapy practice. This powerful software simplifies scheduling, payments, and marketing, allowing you to focus on what you do best, helping clients live better. Visit massagebook.com, create an account, and transform your practice today. Don't wait. Give it a shot today.